Thomas McMurray was an orthopedic surgeon who wanted to use previous history and clinical examinations to help guide the treatment process for knee surgery. This led to first description of the McMurray's test, with the purpose of provoking meniscus tears.
The menisci sit on the tibial plateau. The lateral meniscus is rounded, almost a full circle, while the medial meniscus is more C-shaped. The meniscus has two main functions: to deepen the articular surface of the tibia, thus increasing stability of the joint, as well as to act as shock absorbers by increasing surface area to further dissipate forces. Common mechanisms of injury for the meniscus include rotational or shearing forces placed across the tibiofemoral joint, and risk of injury is increased with an added increased axial load.
Patients with meniscus complications often present themselves with a lack of range of motion due to the menisci preventing flexion or extension, joint line pain, swelling, crepitus or popping sensation. To perform McMurray's test, the patient should be supine. Depending on how the limb is manipulated, different parts of the meniscus can be biased during testing. Knee extension and external rotation with toes pointed laterally bias the anterior lateral meniscus. Knee extension and internal rotation with the toes pointed medially bias the anterior medial meniscus. Knee flexion and internal rotation with the heel pointed laterally bias the posterior lateral meniscus. Knee flexion and external rotation with the heel pointed medially bias the posterior medial meniscus. An audible click, locking, and/or pain can be considered a positive for McMurray's test.
Sensitivity and specificity varies due to the modifications made on the McMurray's test. However, the test's sensitivity ranges from 34 to 88%, and specificity ranges from 50 to 93%. According to McGee's orthopedic physical assessment text, it has a 65% sensitivity and 93% specificity for the medial meniscus, and 52% sensitivity and 94% specificity for the lateral meniscus.
Thank you for watching, and please make sure to like and subscribe.